Well, recently there's been a lot of debate over the efficacy of vaccines, but a new poll found that Georgia parents still overwhelmingly trust childhood vaccines.
Atlanta News First reporter Abby Casoris spoke with researchers behind the poll about the ever-changing federal recommendations.
The Emory Center for Child Health Policy surveyed more than 1,000 Georgia parents and found strong, steady support for childhood vaccines, including 88% who believe routine vaccines are safe, even as national guidelines may soon shift. But even with high trust, many parents say they're still sorting through mixed messages.
Very concerned.
Birthday stories like Charmaine Hutchins reflect what many parents are feeling. They're not rejecting vaccines, they're trying to navigate changing information. The poll comes just days after ACIP, the CDC's vaccine advisory panel, voted 8-3 to end universal recommendation that all newborns receive the hepatitis B shot at birth. Under the new guidance, only babies born to mothers who test positive would get the shot right away. A major shift from more than 30 years of policy that helped nearly eliminate childhood Hep B. Dr. Stephen Patrick warns the change could create more confusion.
You know, some of the arguments seem logical, that if a parent, if a mom is hepatitis B negative, well, then they're not going to infect their infant. But that's not universally true. We know, for one, people can get infected after they get tested, and then they could pass it to their child. But you can also get it from just the community. It's very infectious.
The poll also found that the majority of Georgia parents don't realize that insurance companies follow the committee's guidelines, meaning if they don't recommend the shots, they won't be covered by insurance. Patrick says that's why this Georgia data matters, because what happens in that committee could directly affect what families pay.
These are the diseases that we could be rid of, and I think we forget what things were like 30, 40, 50 years ago, where we had these diseases. And you know, this is why kids today are far healthier than they were 100 years ago.
The Emory Center will release more findings through 2026 as part of its State of Child Health report. In Atlanta, I'm Abby Casoris.